Hello, everyone, and welcome. We're so glad to have you guys here for today's webinar, Low-Dose Naltrexone Unlocked, a small dose making a big splash in inflammation, immunity, and weight. I'm Brittany, a health coach and the social media manager here at Shed, and I'll be your moderator for today. So, whether you're here because you're struggling with chronic inflammation, navigating autoimmune issues, or maybe even exploring weight loss options that go beyond GLP-1s, you're in the right place today because today's conversation is all about real education on a powerful, lesser known tool, low-dose naltrexone, or commonly referred to, and I'm sure we'll be referring to it as LDN for short. We know that many people feel overlooked or stuck when it comes to managing inflammation, autoimmune disease, and weight. And our goal today is to empower you with clear clinical information about how LDN might support your journey in a safe and accessible way. At Shed, we believe your wellness path should be personal and supported every step of the way, which is why we're excited to bring you this conversation today in partnership with Strive Pharmacy and Strive's very own clinical liaison and pharmacist, Megan Kilkeary. So before I introduce Megan and before we dive into this awesome webinar today, I do have a few quick housekeeping notes that I want to go over before we dive in. Number one is just that this session is being recorded and we'll send the replay to your inbox in the next 24 hours, so be on the lookout for that. Second thing is we will have a Q&A segment at the end of today's webinar with Megan. So stick around for that. As questions pop in to your mind throughout this webinar, feel free to drop them in the Q&A box down below. That is open now. And then we'll kind of compile all of those and kick those over to Megan at the end. And then lastly, we will be sharing an exclusive special offer at the end of today's session. So be sure to stick around for that. All right, so I love our beginning of webinar polls. If you guys have joined a webinar with us before, you guys know we love our polls to kind of get to know our audience a little bit better. So I am going to launch today's poll, and the question is, which health challenge are you currently navigating? So the options here are chronic inflammation, autoimmune condition, metabolic or weight concerns, or just curious about LDN, or maybe with the just curious about LDN, it might be some sort of other thing that you're looking into LDN for. I know there's a lot of different things that LDN kind of covers. So I'll give you guys a few seconds to respond to that. Go ahead and select the option that you feel best fits your current experience to help us kind of guide today's session. Okay, so a lot of people, 57% of people just curious about LDN. We have some chronic inflammation, a couple autoimmune condition, and then about 14% metabolic or weight concerns. Awesome. Cool. Well, that is very helpful for us in guiding today's discussion. I'll go ahead and end that poll. All right. Okay. So with that, I'm excited to introduce our amazing guest speaker today, Megan Kilkeary. Megan has over 20 years of experience as a pharmacist, with more than 17 of those years focused in the compounding space. She is passionate about bioidentical hormone therapy, functional medicine, and working closely with providers to create personalized solutions that truly support patients' long-term health. And then most recently, she's enjoyed diving into the longevity space, educating both patients and practitioners on innovative tools for wellness, including what we're talking about today, which is LDN. So without further ado, let's go ahead and dive in. Megan, I'll pass it over to you.
Perfect. Thanks so much, Brittany. I'm really excited to share with Shed and Strive this webinar today and help educate everyone out there about low-dose naltrexone. You know, it truly is something that I am so passionate about. I have seen this drug at use for almost 2 decades now and really believe in the power of how it can change lives. So really excited to dive into all of this with you today. So give me a moment here. I'm going to start sharing my screen with you. And then we will get going. Oh. Perfect. All right. Everybody good? So we've got our starter page up there. And like Brittany was saying, so the title of our seminar today is going to be about low-dose naltrexone and balancing the body using this amazing little drug and how it can work for inflammation, metabolic health, and weight loss. It truly is, a game changer in the space out here in the compounding world. And this first slide here that I'm going to show you is probably one of the ones that I'm most excited about. Um, and that is all of the indications for low-dose naltrexone therapy. So I know today we're really going to be diving into how it helps with weight loss and metabolic disease, but really there are just so many different conditions that LDN has been studied for. There's over 900 clinical articles that have been written about low-dose naltrexone, and it has been studied in over 80 different conditions. So as you can see here, everything from autoimmune diseases, multiple sclerosis, lupus, Hashimoto's, moving over to chronic pain, where we have a lot of inflammation going on. So patients with fibromyalgia, neuropathy, chronic regional pain syndrome, even the neurological disorders. And this is something that I'm also really passionate about speaking with regards to low-dose naltrexone and the potential for the preventative aspects of it when it comes to things like Parkinson's, Alzheimer's, and ALS. We know there's great literature out there on the GI issues like Crohn's disease, ulcerative colitis, irritable bowel syndrome. It's been studied a lot in different viral applications like long COVID. We certainly, again, today we're going to do a deep dive into the weight loss aspects of low-dose naltrexone, how it can help suppress appetite, control those cravings. And then there's also a lot of use for it in the mental health space. We know depression, anxiety, and depression and obesity really kind of go hand in hand. And I'm going to talk about that later on in a really interesting slide. And then also fertility. So polycystic ovarian syndrome, patients that have hormonal imbalance, low-dose naltrexone can also be of benefit for those patients as well. So to kind of the origins of low-dose naltrexone, I think this is such an interesting story. Naltrexone was actually first discovered back in 1962, but it sat on the shelf for a really long time and no one did any studies with it, and it didn't really go anywhere until the 70s. And it started to be used then, they were looking at it for its use in opioid use disorder. So finally in 1984, the FDA approved naltrexone for opioid addiction. And the typical dose for that was going to be anywhere from 50 to 100 milligrams. So this is what we call full strength naltrexone. What we're going to be talking about today are going to be much lower doses, a tenth of that, if not less. So how low dose naltrexone was discovered was back in the early 80s, and we called Dr. Bernard Bahari. He's like the godfather of low dose naltrexone, but he was a Harvard physician. And he was working with addiction, and he had a lot of patients that were taking naltrexone. And he noticed that a lot of them were having increased endorphin production while they were on the naltrexone. And he thought, well, what a novel idea. And what can I do with this increased endorphin production? What other applications might this potentially have? So then he started working with AIDS patients during the AIDS epidemic of the mid 80s. And he discovered that using smaller dosages in his HIV patients, it was having a positive effect on their immune system. So the problem with using full dose naltrexone is it can cause a lot of side effects, including sleep disturbances, anxiety, again, insomnia. And so what he started doing was trying to determine at what dosage can we get naltrexone down to? How small of a dose can we use, but still have that increased endorphin production? So now we've got the benefits of it, but we've taken out a lot of the unwanted side effects. And so he noticed around that 3 milligram a day dose that a lot of these patients were still having increased endorphin production, but without all of the negative side effects. And so the question is now, so what does this increased endorphin production mean? Well, this is one of the key mechanisms of action of how low-dose naltrexone works. So what it does is it temporarily binds to the mu opioid receptors within the body. And this binding is very short-lived. It's only about 60 to 90 minutes it's going to sit on those opioid receptors. And then once it releases from that receptor, it's going to trigger what we call a rebound effect. And that's where we get the increased production of endorphins. And endorphins are those feel-good hormones in our body. Often they can help regulate mood. They can really help with cravings. They can help with appetite suppression. It has a plethora of actions, these endorphins within our body. So by using those lower dosages of naltrexone and having that rebound effect when it breaks off from the receptor, those endorphins can just have such a positive impact throughout our body on so many different systems. The second mechanism of action for low-dose naltrexone is going to be how it reacts to the immune system. And so it binds to these receptors that are called toll-like 4 receptors. And what this does, it helps to turn off the activation of cells. And these cells have the potential to produce these what we call pro-inflammatory cytokines. So tumor necrosis factor alpha, interleukin 6, all of these products produce inflammation within the body. And so by turning off that receptor at the cellular level, we are then decreasing the inflammatory response by decreasing the output of those cytokines. And then also, it regulates those T cells within the body, and those T cells are part of our immune system. So this is the second mechanism of action of low-dose naltrexone. And then lastly, all of these things together, increasing the endorphin output, decreasing inflammation, these are going to help stimulate healing processes throughout the body. So we're not turning off the immune system, we're just helping the immune system kind of get into check a little bit here. And that provides relief from pain. It's going to reduce inflammation. Again, all of those other things that we talked about, on the first slide, or if you remember all of the different conditions that we're using it for. So you can see how the potential for low-dose naltrexone to really stimulate healing across the body for a wide range of conditions. But specifically today, we're going to talk about low-dose naltrexone and weight loss. So there are lots of different mechanisms by which LDN can aid weight loss. The first being appetite regulation. So like I said, we know at those higher dosages, naltrexone is used for patients that have opioid use disorder, also alcohol use disorder. So we know it helps to tamp down on the cravings that those patients have. So LDN may influence, hunger and satiety, and it's through that endorphin regulation and those opioid receptors in the brain that helps with. Again, also reducing inflammation. We know chronic inflammation is seen in all patients that have weight gain and are having struggles with obesity. So that those fat cells within our body are just producing a lot of inflammatory components. And so naltrexone is going to help reduce that inflammation and reduce the output of those pro-inflammatory factors. And then insulin sensitivity. Generally, this is an issue for patients that are having trouble with weight control. And we know this is, where the GLPs come in and work so well, but also low-dose naltrexone. And it's through a different mechanism of action too. And this is why I love pairing naltrexone with GLPs. GLPs are wonderful products, and they have their own mechanism by which they inhibit inflammation and help with weight loss. But also low-dose naltrexone too, by a different mechanism, helps. So they can really work synergistically together to help patients achieve their goals. Improve sleep. We know that poor sleep is definitely associated with weight gain. So naltrexone has been shown to help improve sleep and enhance overall sleep quality. I've seen lots of studies out there that show it actually helps to increase the amount of time that we spend in REM sleep. And REM sleep is that restorative, that dream sleep that we have that is so important and crucial for helping our bodies to restore themselves. So naltrexone can be beneficial there. And again, like I talked about too, the cravings and the addiction like eating, it can certainly help with those and those sugar cravings that a lot of patients will experience when they're struggling with weight loss. So depression and obesity, I think this is such an interesting slide, and there's such a cyclical relationship between the two, and so much crossover as well between them. So as you can see here on the slide, we're talking about the excess fat tissue and the gut inflammation that we have with weight gain and obesity, and that inflammation that is caused in the gut is then going to have an effect on the brain. And there's so much talk nowadays about the gut-brain relationship and how much connection is going on between the two. And it really is true. And this is a prime example of that. So all of that inflammation being produced in the gut is now going to cause neuroinflammation within the brain. That inflammation is going to regulate how we behave. So it can increase a sedentary lifestyle. It can cause us to have those sugar cravings, that addiction like eating, wanting that high fat diet, and then that causes us to put on weight. And then, as you can see, the cycle perpetuates itself. Another thing too that a lot of patients struggle with who have depression is they end up going on SSRI medications. And oftentimes these medications are associated with some significant weight gain. And that has to do because increasing serotonin within the body can cause the body to crave sugar. And that's from a brain level, but then also increasing serotonin levels peripherally causes the brown fat to not be as effective. And that brown fat is really our good fat that is involved in a lot of the metabolic processes of breaking down and losing weight. So the SSRIs really inhibit weight loss across the board. So, low-dose naltrexone, by decreasing inflammation, not only in the gut, but also in the brain, can really help to make these behavioral changes or help patients start these behavioral changes that are going to allow them to be more successful on their weight loss journey. So screening and patient selection. So who are your ideal candidates? I read an interesting article that Dr. Bahari wrote one time, and someone asked him, who do you think is the best candidate for low-dose naltrexone? And he said, everyone. I think everyone should be on low-dose naltrexone. But for the purposes of, weight gain, so obviously patients that are struggling with weight or are obese, definitely patients with metabolic syndrome, insulin sensitivity, and again, those emotional or stress eaters. And also autoimmune and inflammatory disorders. A lot of times, patients have pain, and that will cause them to um, increase, those feel-good foods, those high-fat foods, those high-sugar foods, to give them, a quick endorphin rush to feel better. But really, that's just in the long run causing more problems. We can use low-dose naltrexone to increase endorphins for them and to help them feel better. And again, break that cycle of pain and eating and weight gain that is just cyclical, like that depression and obesity cycle. So as far as exclusion criteria, so what patients are not candidates for using low-dose naltrexone? So patients that are on chronic opioids. So now these aren't your patients that are, going in for a dental procedure and being on medication for just a few days for pain. These are your chronic long-term pain patients. So again, if you remember back, because the naltrexone binds to opioid receptors, there is the potential for it to block the actual pain medication from hitting that opioid receptor and being effective. So that's why we say it's contraindicated in those patients. And again, any patients that have severe kidney or liver impairment, we use caution. And pregnant or breastfeeding, I put this in there, but I always want to put an asterisk next to it. As with anything, I always say consult your OB/GYN when it comes to any medications that you're on during pregnancy or breastfeeding. Now, that being said, if you remember back to one of those initial slides I shared with you, I said that low-dose naltrexone can benefit fertility. And there are some wonderful articles out there showing that especially women that have polycystic ovarian syndrome, PCOS, because low-dose naltrexone can decrease the inflammatory aspects of PCOS, it can help to increase a patient's fertility level. And so those patients who are able to, get pregnant while they are using naltrexone, a lot of times then there is literature on this showing that they will use it throughout the first trimester. And there's a researcher actually over in Ireland doing some studies right now about how low-dose naltrexone can potentially help with implantation of a fertilized egg, and could be beneficial for those patients experiencing fertility issues. So, while I wouldn't recommend patients who are already pregnant get started on naltrexone, if you are taking naltrexone for fertility issues, generally speaking, the literature that's out there is showing that it is safe for them to continue on through the first trimester. So one of the key elements to taking naltrexone is we take it at bedtime. And I get asked this question all the time, why do we take it at bedtime? So this has to do with that opioid receptor blockade. And so the naltrexone works generally between 2 a.m. and 4 a.m. And this is when our body is producing those endorphins for the most part. So we take it at bedtime. And if you remember, I said it sits on that receptor for about 60 to 90 minutes, and then it releases. So around that 2 to 4 mark, to 2 a.m. to 4 a.m. mark, the response is your body has the increased production of endorphins at this time. And then, so when you wake up the next morning is really that rebound effect that you're getting the benefit of all of the excess endorphins that your body has produced while you're sleeping. So again, ideally, we want to take this at bedtime during that 10 p.m. to 2 a.m. time frame so that we can really capitalize on that endorphin production that happens between 2 a.m. and 4 a.m. So dosing for weight loss. So there's two different mechanisms for dosing when it comes to low dose naltrexone. And so for weight loss, we tend to be on the higher end of things. So usually the starting dose is going to be about 8 milligrams at bedtime. And that's what we see available in the commercial product. There is an FDA approved commercial product out there. It's a combination of naltrexone and bupropion. Both of these items are used together to help with weight gain, to help curb cravings. However, bupropion does come with its own set of potential issues. There is an FDA black box warning that is associated with bupropion. So you do have to screen patients appropriately and use caution depending on your patient base and who you're going to use that in. However, naltrexone, on the other hand, has a much safer profile. And so what we have kind of done is take the naltrexone out of there and then made it available at the same dosages by itself to help for weight loss. So again, starting at 8 milligrams at bedtime and potentially increasing to twice a day. So 1 dose in the morning, 1 dose at bedtime. Not all patients need to take it twice a day, however. I am a huge proponent of start low and go slow. So for a lot of patients, an 8 milligram dose is all they're going to need. However, after some time, if patients feel like those cravings are starting to come back for them, then sometimes a morning dose can also be helpful for them too. Now, the dosage that we use for autoimmune and inflammatory conditions is a little different. we're going to start lower with these patients. And a lot of that has to do with the fact that autoimmune patients and patients with inflammatory type conditions can potentially be very sensitive. So when you start modulating their immune system and you start increasing these endorphins and you turn off all of these pro-inflammatory cytokines that are happening, it can really have a huge impact on them. And we don't want to cause any more excitation within their bodies than what they already have going on. So we like to start low with them, about 1.5 milligrams at bedtime, and gradually we increase that dose every few weeks up to a target dose of 4.5 milligrams. So that's the ideal strength for patients that have autoimmune and inflammatory type conditions. And I get this question all the time. And providers ask me, well, what dose should I go with? And, I say to them, what is your patient's primary concern? So if you have a patient that's coming to you and maybe they're on a GLP and they have Hashimoto's disease, or they have multiple sclerosis, or they are having issues with osteoarthritis, then I would say we are going to use the lower dosage and work them up to the 4.5 milligram. If you have a patient that is on a GLP and they're struggling with issues of plateauing, they're not seeing any more weight gain or I'm sorry, weight loss, or maybe they are interested in starting to come off of a GLP, then using the higher dose, the 8 milligram naltrexone, would be ideal for that patient population. So it's always important to, educate patients and set expectations for weight loss. Low dose naltrexone is not a GLP. They are not going to see weight loss within the first 1 to 2 weeks, and they're not going to see it at the rapid rate that we see with GLPs. So the timeline for weight loss with low dose naltrexone is very gradual. It's usually over a course of about 3 to 6 months that the patients are going to experience it. And like I said, it's important to let them know that naltrexone is part of a comprehensive program. Whether that's adding it onto a GLP, whether that is using it as part of hormone replacement therapy, this is just another tool that we have in our toolbox to help. And again, as always, making those lifestyle changes are always critical at making sure that patients have the highest success rate for weight loss. And again, it's important to know too that it's generally safe for long-term use. We should always reassess medications, over a period of time to see how patients are responding and how they're doing with them. But I can tell you from experience, I have known patients on this drug for 20 years and have used it safely for a very long period of time with no issues. And so again, long-term use with this is very safe. So as far as side effects go, it's very well tolerated, like we talked about. Some of the most common occurrences that we hear about are going to be mild sleep disturbance. So sometimes vivid dreams are what patients are going to report back. And if you remember me saying earlier, I talked about how low dose naltrexone can increase REM sleep, and that's that restorative dream sleep that we have. That's a reason why patients will report back on those vivid dreams. So they're usually mild, but they will subside in a few weeks for most patients. And also, as you can see here, sometimes mild headache or some mild GI side effects could happen. Usually it's less than 10% of all patients are going to report back on these type of side effects. And like I said, they usually do subside within a few weeks. There is no need to make up a missed dose of naltrexone. So if a patient misses their bedtime dose, they don't need to take it in the morning. They can just wait and take their dose the following night. If they have discontinued therapy and they want to start again, then we do suggest restarting that titration if they're working up to the 4.5 milligrams. Generally speaking, if it's been less than 4 weeks that someone has been off of naltrexone, there's no need to restart the titration. If it has been longer than that 4 week period, then we recommend going ahead and titrating up again slowly. So one of the other things I always like to counsel on with low-dose naltrexone are patients who might be going in for surgery. So again, because it binds to, because low-dose naltrexone and opioids bind to the same receptor sites, it's going to fight for action there. So it's going to potentially inhibit the pain control effects of the opioids. Now, low-dose naltrexone has a very short half-life, and it's about 4 to 6 hours. So it's generally cleared from the body within 24 to 48 hours. So if a patient has a scheduled surgery coming up, I usually recommend them stopping it about 48 hours prior to the surgery and then pausing it if they're going to be using any type of opioid pain medication post-surgery. Again, they can restart their LDN at their previous dose as long as it has been less than 4 weeks once they have stopped taking that opioid pain medication. And generally speaking, it's not an issue if someone needs to go in for an emergency dental procedure or something like that. We don't worry about that too much. Again, we're talking really low dosages from those high 50 to 100 milligram dosages that are usually used to block opioids. Um, and that full effect there. So just to recap, the power of low dose naltrexone. So, and all of the amazing things that it can do, it can reduce chronic pain through increasing those endorphin levels. It can help to lower inflammation. So it helps to turn off overactive immune cells within the system that drive inflammation. It helps to regulate the immune system. It's great for autoimmune conditions. And again, it helps to improve mood, reduce those cravings, those endorphins, the feel-good chemicals within our body. Increasing those will reduce anxiety and just that overall sense of well-being. So I think low-dose naltrexone is such a powerful medication for, how small of a dose we can use in patients. And I really get excited talking about it and talking to patients about it and educating providers on it. And again, like Dr. Bahari said, who is your ideal patient for it? I think everyone is, to be honest with you. And this was just a little snapshot too of what naltrexone can do. I have had the wonderful pleasure of speaking to the power of it when used in an oncology setting and when used to help prevent neurodegenerative diseases. I think these potential applications for low-dose naltrexone are also extremely exciting, just beyond, weight loss and what our focus was here today. And so that's it. That's the end of the presentation. Thank you all so much for listening in and for tuning in. I hope I have lots of good questions out there that I will be happy to answer.
Awesome. Thank you so much, Megan. That was an awesome presentation. And we just appreciate you for walking us through the science and the clinical insights and honestly, real world use of low dose naltrexone. I know there's tons of different uses, so it was so cool to kind of get a peek into each one. And for everybody watching, we hope this gave you a clear understanding of how LDN works from its origins in immune modulation to its potential for reducing inflammation, improving insulin sensitivity, regulating appetite, and even supporting mental well-being, which I thought was really cool through that endorphin connection. If you would like to explore whether LDN might be right for you, we do encourage you to speak with one of our shed providers to explore whether it's a good fit for your individual needs. And so how to do that for existing members who are already on a prescription medication with Shed, you can do this by scheduling an appointment through your Shed portal. And then for new members who are new to Shed, go ahead and head to our website, tryshed.com, and you'll see some tabs at the top. Hover over the longevity and vitality tab and click on low dose naltrexone, and that'll give you more information to learn more and to get started there. And then, as promised, and as a special thank you for attending today's webinar, we're offering an exclusive 20% off of your first month of LDN with the code LDN20. This offer will expire in 1 week from now, so next Tuesday, August 5th at midnight. You'll receive this information in a follow-up email with the replay and everything. So be sure to use that code at checkout. Okay, cool. And I know we had some really awesome questions for Megan in our Q&A box. So if you haven't already, go ahead and drop your questions there and we will start sorting through them and I'll start kicking some questions over to you, Megan.
Perfect.
So first question. So this person has been taking LDN for 8 weeks and hasn't noticed anything as far as chronic inflammation and pain go. I know you talked about the timeline of like visible weight loss, but in terms of chronic pain and inflammation, should they expect to see, like, what is the timeline of expecting to see results with chronic inflammation there?
Sure, absolutely. And this is a great question. And the best answer I can give is a little anecdotal story. And it's a friend of mine, and he was taking low-dose naltrexone for several months, and his prescription ran out. And he just decided not to get it refilled. He didn't feel like calling his doctor. So he was off of it for about a month. And then he called me up at the pharmacy and he said, can you please call my doctor and get that refilled? He said, I didn't realize what it was doing for me until I stopped taking it. So he felt like while he was actually on the naltrexone, he didn't necessarily feel anything specific while he was on it. But then after he stopped, he realized, wait a minute, I did feel better, or some of these things that I didn't realize had actually improved. So urge patients, even if you might not think it's doing something, I can tell you it is having an impact. Because we know just from the science perspective how it's increasing those endorphins and how it's working on those microglial cells within the central nervous system to, turn them from an overactive state and to deactivate them. We know that is decreasing inflammation in the body. And so while you might not always feel something immediately from it, the potential long-term effects are good too. Just because decreasing chronic inflammation overall is going to decrease all of these potential diseases that we get as we age. So, I think that's important to keep in mind. I personally take low dose naltrexone, not for anything specific, but again, just to try to decrease overall inflammation levels within my body and just have more of a preventative type effect.
Yeah, I think it's very fitting that it's in our longevity category, right? Thinking about that kind of long-term
Yeah,
effect.
but it is hard. It is hard, especially when, anytime you start a medication and you're hoping to, really see substantial side effects from it. This might not always, with low dose naltrexone, that might not always happen. So.
Yeah. Okay, awesome. Next question is, what are your thoughts about naltrexone and bupropion? I know that we carry that as an
Mhm.
additional solution, and I know you mentioned a couple things about bupropion and some of its side effects.
Sure.
But could you give just a little bit more insight into maybe naltrexone and bupropion versus LDN?
Yeah, absolutely. Well, we definitely know that the combination of naltrexone and bupropion is effective for weight loss. It is part of a commercial FDA approved product that's out there. So there are clinical studies to back that the combination of those two ingredients definitely helps with weight loss. Now, that being said, bupropion might not be the best medication for all patients. There are additional things that need to be taken into consideration before starting someone on bupropion because of the potential side effects for it. And naltrexone is also generally tolerated better than bupropion. So, I think the combination definitely has a place in the weight loss space. But for some patients, that combo might not be the best option for them, depending on other underlying disease states or factors that they have going on. So that's why for some patients, just naltrexone by itself itself can potentially be a great option. The other thing too that I want to stress is in the commercial product that's out there, the amount of naltrexone that's in there is a lot higher. And in our functional wellness community, we're not a huge fan of high doses of naltrexone. There are some side effects that I talked about earlier, anxiety, more major sleep disturbances that you see with the higher doses of naltrexone. So keeping it low, like you see from the standpoint of what compounding pharmacies are able to do, is really the best way to go, in my opinion.
Awesome. Yeah, I think kind of making it more of that personalized from what we're learning from maybe more commercial products or those sorts of
Mhm.
things is awesome. And I just want to let you guys know too that always feel free to schedule an appointment with one of our shed providers to discuss if this is appropriate for, your individual needs and some of those things that Megan mentioned there. Next question. Is it safe to take LDN with melatonin extended relief at bedtime?
Yeah, absolutely. You can certainly take low dose naltrexone with melatonin. I love melatonin. I don't think most people realize melatonin is actually a hormone. And so it's really important. It plays interestingly with cortisol. And so cortisol and melatonin do a really neat dance within our bodies. So as melatonin levels rise, cortisol levels should go down. And then conversely, in the morning, melatonin should go down and cortisol should go up. So, it's this harmony that we're looking for with these hormones within our body. And low dose naltrexone is a wonderful addition onto that. It can certainly help with sleep. It's going to work from a completely different mechanism of action than melatonin is going to help with sleep. But again, because cortisol and melatonin are hormones, we know that low dose naltrexone also helps to support hormone production through that decrease in inflammation. So, absolutely, you can safely take them together. I'm, again, a big fan of using those.
Awesome. And then we had a question that said, interested in LDN and fertility.
Mhm.
Can't go over that again. I have PCOS and I think LDN might be a good fit for me. So, any other thoughts that you have on PCOS, infertility, those things?
Yes, absolutely. So, PCOS has so many inflammatory components to it. So, patients that suffer from that are going to have inflammation. They're going to have issues with insulin resistance. And these are aspects that we know low dose naltrexone can definitely impact. I can tell you, again, anecdotally, I have worked with a fertility clinic for many years. Every patient that walks in the door, they put on low dose naltrexone because they just feel, from an inflammatory standpoint, from a safety and side effect profile, that it's a no-brainer. It's a really easy answer for potentially a lot of issues that these patients are having. So there's some great clinical data out there on fertility and low dose naltrexone. It's easy to find and Google, so highly recommend looking into that. But yeah, I think that would be a great option and a safe option for patients suffering.
Awesome. So cool. Okay, a couple more. We have a couple more minutes. Can you be on LDN and donate blood?
Yes, not a problem. So naltrexone is not it's not a controlled substance. It is not, there's no issues with it from a performance enhancement standpoint. There's no issues with it, again, from a blood donation standpoint. So, across the board, whether, it's an athlete, concerned about, performance enhancement drugs, or someone who maybe has to be routinely drug tested for their job, low dose naltrexone is not an issue, for any of those patients.
Awesome. And then last question, and I know you kind of went over it, but just to get that direct answer, someone asked, let me find it. Oh, if LDN helps you stay in REM sleep, will I have more dreams while taking it? I know you said vivid dreams are common, but maybe that more dream aspect.
Yeah, and so initially patients will often report back those vivid dreams. And what we think is happening is because they're spending more time in that REM sleep, now, we all dream, but that doesn't necessarily mean we remember it when we wake up. But if we end up spending more time in REM sleep, there is more of a potential for us to start remembering those dreams. And that is something that does go away with therapy, as it goes on. Most patients will report that, at first they really notice it, but then their bodies start to adjust and they adapt back, and really kind of stop remembering those dreams after a while. But those first few weeks, a lot of people will report those, and it's so funny too. I've had so many patients come to me and they're like, yeah, I'm gonna take my naltrexone and get ready for the movie tonight that starts in my head. So some people really like it. They think it's pretty interesting, what their brains and their bodies are doing. So I've had some people that really enjoy those vivid dreams, and but other times they can be disruptive. But that being said, again, they generally subside. There have been a handful of times over the years where I have had patients just come to me and say, this has been going on for a really long time, and my sleep is just, really impacted by it. One of the things that you can do to potentially mitigate that is to take your naltrexone earlier in the evening. So maybe around dinner time, if those side effects are not going away for you. So that is an option, taking it maybe like around that 6 p.m., 6 to 7 p.m. hour in the evening versus that later time frame that I talked about. That could help mitigate someone who's having long-term issues with sleep disturbances.
Okay, wonderful. Well, thank you so much, Megan, for all of your insight today, for answering these questions. And thank you, everybody, for attending today. One final thing that I wanted to mention about the coupon code, again, that's LDN20 for 20% off of LDN for your first month. I originally said it would be for a week, but it looks like scheduling wise, some people might not be able to get appointments in time for that. So we will honor that coupon code for up to 30 days. So I just wanted to clarify that before we hop off today. But other than that, everybody have an amazing day. Thank you, Megan. Thank you, Strive. And we will see you here next time.
Thanks, Brittany. Bye-bye.
Bye.